We have a fact check on a nasal flu vaccine that was just approved for at-home use. It's called FluMist. Previously, it was only available at pharmacy and doctor's offices, but now you can order this nasal vaccine online and have it delivered to your door. So we want to make sure people are taking this in a safe and effective way. This vaccine is also designed for certain people. So I'm here with Dr. Nita Bijoor from Oakview Medical Associates in Greenville. Thank you so much for being here today.
Thank you for having me.
So tell me a little bit, how does this nasal vaccine work?
Yeah, this is exciting because for all of us that are needle averse or don't have time for the doctor's office, it's a great option. The FluMist, which is the intranasal vaccine, is not new. It's been around, but the previous strains of the vaccine were not that efficacious, so it was not very popular, but they've redesigned the formula, and I think they've now made it available for home delivery, which is really exciting.
So who should take this at home and who should not?
Healthy individuals between ages 2 to 49. That's what it's approved for. Those that are, without any asthma, any wheezing, any active illness. So basically those with good immunity can have it.
Is there a difference between this nasal vaccine and the shot?
Well, overall, the efficacy is pretty similar. What we had is the flu vaccination rates were really low in the last few years. So now this gives people an option to have an at-home delivery. So, no excuses. You have it at home and you can pretty much, it's on you to take without a needle. In terms of efficacy and effectiveness, pretty similar.
Interesting. Now, I know some people, as you mentioned, they're maybe afraid of needles. There's others who have allergies to certain chemicals in the vaccine.
Right.
Is this one a safe option for those who have allergies to the vaccine that you get through a needle?
Right. So if you are allergic to other components of a previous flu shot, then this would not be an option. Okay. Egg allergy also is a contraindication. Yeah. And then those that have severe respiratory illnesses, asthma, under 2 years of age and over 49 years of age.
Is this typically covered by insurance?
Yes, so what we're finding is it is pretty much covered by Medicare and the other commercial insurances, and it's the home delivery, so I think that's about $10 for a package of 4, and it's a single dose. You just spray one into each nostril.
And I know with the flu that's going around, oftentimes we look at Australia or places elsewhere, and then we base our vaccine off of what we're seeing over there. So any idea of what we can expect this flu season?
Well, I'm just keeping our fingers crossed for a good season overall. I think the main prevention is hand washing, not going out when you're sick. All those are really important. But hopefully with a lot more options, patients will really get vaccinated. Our rates will go up, and that'll provide really good herd immunity.
Any risks that people should know about this nasal flu vaccine?
Risks in the sense if you are allergic to the egg or you are allergic to any other components of vaccines in general, then this would not be one for you because this is a live weakened virus. It's not an inactivated virus like the injectable. So these are literally live viruses that were weakened. So in someone with good immune system, it's okay, but if you have a weak immune system, this is not for you.
I also read that for kids ages 2 to 4, there could be a chance of wheezing if they take the nasal vaccine.
Right.
Which also with having a 2-year-old, I think it'd be hard to get a nasal vaccine.
Yes, I wouldn't
apply it for those kids. So, oh great. Well, thank you so much for joining us today. Again, yeah, the details are right there on the screen for those who it's recommended for, some risk factors as well. So, Thank you so much for joining us today.
You're welcome. Thank you.